Okay, I think we'll get started. Thank you all for coming out at this late 5 o'clock hour on day one. I know that you probably rather want to be at cocktail hour or get ready for the opening ceremony, but I do want to thank you for joining us to learn about steps towards stomping out burnout. My name is Namita Jayaprakash. I am an emergency medicine and critical care physician at Henry Ford Hospital.
And I'm Caroline Dowers, and I'm emergency medicine at Henry Ford Hospital in Detroit as well.
Unfortunately, we're junior faculty. We have no financial disclosures or commercial relationships to disclose to you today. The objectives of our talk, however, are to briefly define burnout syndrome and how it affects emergency physicians. We're going to summarize some of the available assessment tools that you can use to evaluate and quantitate burnout. We're going to discuss some organizational strategies that potentially improve burnout, and we're going to give you a couple of examples from our own experiences at institutions that we've worked at. Burnout syndrome was first described by Christina Maslach in the mid to late 70s. She did several field investigations, mainly focused around mental health workers. And what she identified were a work-related constellation of signs and symptoms that she saw repeatedly amongst these healthcare workers. And interestingly, in people who did not have psychological or psychiatric disorders in their histories. She defined burnout syndrome as being characterized by emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. Burnout is an important topic in the 21st century amongst healthcare providers. It's especially important and prevalent amongst physicians. In a 2014 national survey of the American Medical Association physicians, of those that responded, over 54% reported burnout symptoms. Of these, close to 50% had high levels of emotional exhaustion, and about 40% had high levels of depersonalization. 40% of these physicians screened positive for depression. And an alarming 7% reported suicidal ideation in the preceding 12 months. Emergency physicians are particularly vulnerable to burnout syndrome. Every year, Medscape, in the last couple of years, has conducted a survey of physicians looking at burnout. This is a graphical representation of the 2017 results. These are the specialties in which 50% of the respondents reported burnout symptoms. Emergency medicine was the leader on this scoreboard. Now, ordinarily, whenever I see emergency medicine at the top of the scoreboard, I'm excited about it. I'm like, yes, we finally made it. Unfortunately, this one did not excite me. I was a little alarmed to see this statistic. We know it's prevalent amongst physicians, and emergency physicians in particular. But how do we measure it? How do you quantify burnout? The literature describes several different tools that you can use. The most commonly used tool is the Maslach Burnout Inventory. This is a 22-point questionnaire that addresses 3 different domains: emotional exhaustion, depersonalization, and personal accomplishment. The higher the scores in emotional exhaustion and depersonalization, and the lower the scores in personal accomplishment, the higher your burnout rates. Now, as an emergency physician, I've come to learn that I have a very short attention span. So 22 questions for me is just way too much. So if you're like me, try the abbreviated Maslach Burnout Inventory. This is a 9-point questionnaire. Again, it divides it into emotional exhaustion, depersonalization, and personal accomplishment. Respondents are asked to rate themselves for each of these questions on a scale of 0, which is never having felt that way, to 6, having felt it every day. Now, if your attention span can't even handle the 9-point abbreviated version, well, Colin West and his group check the concurrent validity of single item measures of emotional exhaustion and depersonalization, and have used it as a good screening tool for burnout assessments. So take a moment here. In this room, ask yourself, have you felt burnt out from your work? Have you become more callous towards people since you took your job?
So some of you might find that you are feeling a little burnt out after asking those two questions. So your next question might be, well, are there actual interventions that I can do to help prevent any further burnout? Fortunately for us, there is some data out there looking at interventions and their effect on physicians' burnout. This is a meta-analysis, which was by Colin West and his group, from 2006, published in The Lancet. They did a systematic review, and they looked at randomized control trials as well as cohort studies, and these were looking at different interventions and the improvement in physician burnout. When you take a look at this figure, you can see that on the right side favors intervention versus on the left side favors the control group. Looking at the randomized controls and the cohorts, they then split them into the type of intervention. Some interventions were considered more systemic. They were organizational approach, so things such as reducing the number of shifts that clinicians were working or reducing the number of hours that went into each shift. Others were looking at more individualized approach, so telling physicians to go to a course on mindfulness meditation or participating in wellness workshops. What they found was that they had a significant decrease in burnout. They went from 54% down to 44% across all of these studies with having these interventions. Interestingly, the individual interventions, while positive, did less than what the organizational or systemic approaches did. They had more impact when you had a system approach to reducing burnout. Next study is also a meta-analysis, which was looking at the same question. Do interventions that are individual versus group-wide improve our burnout? This study similarly found that those interventions that were from a system approach reduced burnout a moderate amount, compared to those that were individual were just a small amount. And same idea on this figure that you can see the right side favors intervention, the left side favors control. These studies were all randomized control trials, or they were before and after intervention studies. What they concluded after looking at all this data was that your best approach is actually really combining the two, that it's important to have an individual approach to wellness, and then you get an added support when you add in organizational approaches as well. So you kind of ask yourself, well, how can an organization work towards reducing burnout? What are these steps that we should take? From the Mayo Group, John Noseworthy is the CEO, and Tate Shanfelt is one of the leading physician wellness researchers. He's published a lot on this topic. They put out this article that was discussing different organizational strategies to promote engagement and reduce burnout. And they actually list 9 different things that you can do as an organization to help reduce your burnout. The first thing, an obvious first step, is to acknowledge burnout within your organization. And they recommend doing this on a variety of different levels because you have a large organization, so doing things such as town hall meetings on it, sending out emails, having small meetings to discuss what burnout is and bring up the situation. After that, it's important to assess what level of burnout your organization has. Well, we talked about the different tools that we can use, and we always recommend that when you use these tools that you keep the information anonymous. That way you get your most obvious and reliable answers. But it is useful to break it down into different groups. So if you're comparing emergency medicine physicians to critical care docs, or if you're comparing only your nocturnists to those who have rotating schedules, that way you can really assess what the burnout level is at each of those moments and what you should be doing for next steps. Your next thing is to recognize behaviors. This is talking about recognizing behaviors in leaders that promote wellness and also recognizing those behaviors of leaders that take away from wellness and increase your burnout. It's also very important for leaders to recognize their employees and what their specific skills are. Studies have shown that physicians that devote 20% of their professional effort into things that they find meaningful have reduced burnout. So being able to encourage that among your group is very important. You want to take a systems approach. You want to find specific interventions for your system that you can implement and then evaluate how that intervention worked. When you're giving incentives for all of this work, it's very important that you keep in mind certain incentives that you use could have positive as well as negative effects. So we do encourage incentives, but always keep that in mind when you're starting them. Cultivating community is another very important point that they mention. And when we talk about the physician lounge, that's a model that's gone away in many hospitals. But the physician lounge is actually very important at Mayo Clinic, and they actually had brought it back because it helps cultivate a sense of community. As physicians, we have very unique demands. We have a very unique career that many people cannot relate to, but we all can relate to one another. And I'm sure many of the older physicians in the room have been there to mentor many of the young physicians in the room and vice versa. So it's something that's very important within your group to help cultivate that sense. You want to be able to study the issue as well. We do not have enough literature on wellness. And if you are going to make any of these implementations within your group, we recommend studying before and after those specific interventions and seeing what exactly happened. Every group has a specific mission statement. They recommend that every few months you go back and make sure that the actions of your organization are aligned with the specific missions that your group has set out. This is an important one that I'm sure many of you feel, is trying to promote organizational work-life balance. And one way that they recommend doing this is by offering physicians to go to part-time or reduced clinical work. Obviously, that'll come at reduced income as well, but there are physicians that feel like they would rather have more time and less income. And last but not least is providing resources. So many groups have started wellness initiatives and preventing burnout by demanding that people go in and go for mindfulness or like communications training. And when you demand something of people, it tends to not be as well received. So what they recommend in this article is actually aligning this with your assessment of your physicians. So when they go online and they take a burnout inventory, if they see that they have certain areas that they're struggling in, when they're done with that, give them those resources that they can go and do on their own. So having talked about that, I'd like to give a little insight into our experience at Henry Ford and what exactly we did. I was actually a young resident when I was feeling the effects of burnout, and our organization decided to do something about it. We had a study which our aim was to reduce burnout amongst the residents as well as improve learning. Our group was 50 emergency medicine residents as well as combined emergency and internal medicine residents. And our intervention was email-based. So we sent out emails every day to our control group that gave instruction on wellness, gave instructions on preventing burnout, improving your circadian rhythm. And we also encouraged journaling as well as reflecting on 3 things that you're grateful for every day. Our outcomes, we're looking at the Maslach burnout inventory again, the ProQual, which is a study that looks at the quality of life, and then using IATE scores to see how that might improve learning. I'm still amazed at all my co-residents for filling out that MBI, 22 questions, back and forth, at the beginning and the end of the study. So you can do it. I trust you. So this is what we looked like at the beginning. We had a lot of burnout. And between the two groups, it was actually pretty similar. After our intervention, we saw a positive trend. So we saw a reduction, or a trend toward a reduction in burnout scale, emotional exhaustion, and depersonalization. So this was a quick study and relatively simple, and I would encourage everyone to go out and do the same, that if you're going to implement an intervention, try and see if it has a good effect. What are we doing today after this study? So we actually have a system-wide wellness task force. We have a chief wellness officer, and every month they have wellness, grand rounds, lectures on various wellness topics. They've also given the residents now 2 wellness days that they can go out and do things such as a dentist appointment or a doctor's appointment that otherwise they'd have to do in their off or vacation time. Within our emergency department, we actually have a great operations team that has done things such as scribes, which help reduce your clerical work and improve efficiency among physicians. And we have an emergency department wellness committee, which does things such as bringing in pet therapy for our physicians and our staff during specific shifts. And we also have routine get-togethers, and we've started a wellness curriculum for our residents.
So shifting gears away from the Henry Ford experience, I'm going to tell you a little bit about my experience when I was a critical care fellow at the Mayo Clinic. Now, at Mayo, we have about 45 critical care fellows, and the fellows had self-reported increasing levels of burnout, particularly emotional exhaustion. And one of the thoughts behind that was that we actually were working in a shift system. So in the ICUs, we work 12-hour shifts, 6 a.m. to 6 p.m. and 6 p.m. to 6 a.m. Now, as emergency physicians, as shift workers, you are probably very familiar with the fact that shifts disrupt our circadian rhythms, and that rotating shifts, particularly night shifts, lead to fatigue and sleep deprivation. So with an aim to optimize the shift schedule pattern, we decided we were going to change things around. This is the original pre-intervention medical ICU rotation shift. So every month there were 6 fellows assigned to the medical ICU. And depending on which row you were fortunate to get, you might have a couple of nights on, a couple of days off, 3 nights on, back again for another session of 3 nights. Sometimes there were rapid changes from night to day without much sleep in between. As an emergency physician used to working shift work, I recognized that this was going to lead to chronic exhaustion and hypothesized that perhaps that's why my co-fellows felt so emotionally exhausted. So the fellowship program helped us set about changing the shift pattern. We moved to a system where each fellow would only be obligated to do 1 series of night shifts in a row per month. A period of recovery was incorporated into the schedule with a couple of days off so that your circadian rhythm could readjust before you went back to your day schedule. This simple intervention of minimizing the number of day-to-night shift rotations, of incorporating a scheduled recovery period, and limiting the number of recurrent consecutive night shifts improved the fellows' self-reported burnout scores, and in particular, their emotional exhaustion.
So how can you tackle burnout? So number 1 is identifying the champions within your group. Maybe it's you. Maybe you want to take this on as your own personal mission and be the person that's pushing for wellness within your group and organization. Your next step is to get the leadership on board. We've been very fortunate that we've had leaders that are very aware and in tune with this. If your leadership's not on board, I guess have a mutiny. Not really sure. Next, you want to do a baseline assessment of burnout within your organization. So get an idea of how burnt out your fellow physicians are and what are your areas of need. After that, brainstorm about what intervention you want to go ahead and do. From then, implement those interventions and then take a look back 6 months later and see how you're doing.
So in summary, burnout is prevalent amongst physicians, especially emergency physicians. Learn how to identify the issue. Learn how to evaluate it, learn how to assess it, take back the tools of how to quantify burnout. Remember that the interventions to improve burnout do seem to have a positive effect. And it does seem to be a combination of both individual-directed and organizational strategies. Today we've given you 2 examples, simple interventions that have occurred at an organizational level, tackling both physicians as individuals and your work schedule. And I hope that over the last 20 minutes, while you've joined us, you've been able to learn, take away some tools that you can take back to your own institutions to provide some steps towards stomping out burnout. Thank you. Happy to take any questions.
Questions?
Do you know if burnout varies significantly across some key demographics, particularly gender, race, ethnicity, and
So the studies so far have focused on specialties and not the subspecialties. So certainly burnout is high amongst emergency physicians, it's high amongst critical care physicians. Past studies, interestingly, looked at gender variations, and the Medscape study from the 2017 study actually reported there were increasing levels of burnout amongst women over the last 5 years. The AWEM group has actually tapped into some survey data through ABEM, and it hasn't been published yet, but their findings are a little bit different. So I do think that there are differences, but perhaps that things are changing over time. Certainly, if you look at the Medscape 2018 data, emergency medicine is no longer the leader in burnout. It's actually critical care. So I think I'm a little bit screwed, but it does vary year to year. Now, we're consistently into the top 5 specialties, however.
And when you look at studies, it varies from study to study. So some studies will report that women have higher burnout. Some studies, their group, men had higher burnout. And it's probably challenges within that specific department. Same thing, they have studied people that have families tend to have higher burnout than people that don't.
The curriculum interventions that was done at your residency, was that mostly for wellness, like sleep or food or other things, versus was there a focus on resiliency and tenacity?
It wasn't resilience training. It was predominantly wellness, like sleep, health, fitness, yeah. All right. Thank you. Oh,
One more.
Was Honest John's not a part of the...
it should have been. You'll have to talk to Dr. Bora.
Thank you.